Calgary elbow. Honourable member. Honourable member. Please put it down. You're interfering my view to the member whose turn it is to now speak. Calgary elbow.
Thank you very much, Mr. Speaker. Last week, I had an unexpected opportunity for an up-close and personal tour of our healthcare system, and I am proud to say it was there for me when I needed it. And I know there are people who fall through the cracks, and we still have a lot of work to do in this province on prevention, chronic disease, and mental health, but our acute care system is truly world-class. Every single frontline worker I encountered, from the admissions clerk to the amazing nurses, from all the porters and doctors and cleaning staff and everyone in between, all were compassionate and professional, and Mr. Speaker, we're truly lucky to have them. To the Minister of Health, what are you doing to ensure the voices of people on the front lines are being heard and the suggestions they make are being listened to?
Honourable Minister of Health.
Thank you very much to the member, and welcome back. We're pleased that you had a successful experience. One of the things that I personally do regularly, and I know our CEO for Alberta Health Services does as well, is do site visits. Just for example, this morning I met with staff at Boyle-McCauley Health Centre. Regularly we tour AHS facilities as well and have opportunities to chat with some of the staff on the front lines and meet with their elected representatives through their unions as well, Mr. Speaker. It's important that they have a voice, that their voice is heard within their organization, is respected in their government, and that's what they have in this government.
For supplemental.
Well, Mr. Speaker, I'm very glad to hear that, because while I was in hospital, staff told me about some of the challenges they face and shared with me some ideas about how to fix them. I was told it takes $8 to process every single blanket they use. I learned that it costs $500,000 to paint a small space in emergency, or that an ordinary office desk that costs about $1,500 at Staples cost more than $12,000 when it was acquired through the AHS procurement process. And these are just stories that I heard in a little more than 24 hours in hospital. Again, to the Minister of Health, do you hear these sorts of stories from the front lines? And when you do, what do you do about them?
Honourable Minister.
Thank you very much for the question. I welcome the member to pass along those details to my office. I'd be very happy to share them with Alberta Health Services, which is definitely, I have a regular meeting with the CEO of AHS, with the Deputy Minister and myself. It's important that we're at the same table, that we have an opportunity to raise specific questions and concerns with each other, and to make sure that we're bringing about the very best results, using our investment effectively, and finding ways to improve efficiencies, and that's why we're also looking at operational best practices, Mr. Speaker.
Supplemental.
Well, thank you, Mr. Speaker. Now, it sounds like a lot of the complaints I heard stem from the procurement process. Now, this government's been in power for nearly 2 years, and they haven't made any meaningful changes to these old, broken, and expensive processes. Now, I realize there are special considerations when buying medical equipment or renovating a hospital, but there's a huge missed opportunity here for savings. Again, to the Minister of Health, outside of nationalizing laundry and lab services, do you have any plans to improve AHS procurement to focus on real savings in areas that won't hurt frontline care?
Honourable Minister.
Thank you very much for the question. The hyperbole around how we're going to protect Albertans and make sure that we have effective and efficient systems, I'll be happy to expand on tonight in estimates, I imagine. I also want to say that I'm happy to talk about procurement. We've brought in a number of initiatives through Alberta Health Services. They've been very effective in finding many areas for significant savings. I'll be happy to detail those through a tabling later this session. And we always are looking for more ways to be efficient, Mr. Speaker, rather than just pushing the slash and burn budgets that the official opposition and third party, their best friends, are pushing. We're effective in making sure we can find ways to use Albertans' money most effectively.
Thank you, Honourable Minister. Member for Edmonton White Mud.